My name is Heather, and I'm a nurse at SickKids. I am here today to tell you all about getting a saliva test. Saliva is the clear liquid in our mouths. It helps us chew food and swallow more easily. Saliva can also tell us what kind of germs live inside our bodies. I'm sure you have heard people talking about the coronavirus. The coronavirus is a type of virus made up of tiny germs that travel through the air when we cough or sneeze. It can also stay on surfaces that people touch. This is why we are being so careful to wear our masks when we leave home and to wash our hands a lot. Some people that get the coronavirus may feel like they have a cold and can have a fever and cough. Some people may not have any symptoms at all. Today we are going to do a quick and easy test called a saliva test, where you spit into a container. This test will tell us if you have the virus, and then we will know the best way to take care of you and keep everyone safe. If spitting into the container is too hard for you, that's okay. We can do a nasal swab that will give us the same information. I'm going to explain how to collect a saliva or spit sample and give you a few tips in case you're having trouble. I have a special guest helping me today. I would like to introduce you to Jazz.
What can I do to prepare for the saliva test?
Some kids tell us it helps if they drink a cup of water 1 to 2 hours before doing the test. Doing this will help to produce more saliva in your mouth. Also, make sure you don't eat, drink, brush your teeth, smoke, vape, or chew gum for at least 30 minutes before you collect your saliva sample. You may be doing your test at home, in the car, at a testing center, or even at school. You can decide if you want an adult to sit beside you while you do the test, and if you would like to sit down or stand. You should come to your appointment with your mask on, and be sure to clean your hands. If you want to practice making saliva and spitting at home, there are some tips and tricks you can try. You can try wiggling your tongue around in your mouth, sucking your cheeks in and out like a fish, and saying the number 2 when you spit.
2.
You can also think of your favorite food and pretend you are chewing. If you are finding it hard, then your parent can help by gently rubbing the outside of your cheeks. They can also show you to spit into a container by practicing with you. When it is your turn, you will be given a tube or container. Open it by twisting the cap off. Don't worry if you're not sure how to do this. Someone will be there to help you. Clean your hands by using some hand sanitizer, and then take your mask off and place it on a clean surface. If you want someone to hold the container for you, then ask an adult for help. Your job is to keep the spit in your mouth without swallowing, and then to aim and spit into the container. It might take a few tries to fill the container with enough spit for the test. You need 1 to 2 milliliters of saliva for the test, enough to get to the top of the cone in the container. This might be more than you think it is. Someone will let you know when there is enough. When you are finished, twist the cap back onto the container and make sure it is tight. Then sanitize your hands and put your mask back on. That's it, you're all done. Remember to make sure someone writes your name and birthday on the bottle so we know whose test it is. It's important to remember that not all kids that have a saliva test will have the virus. This test is done so that we can keep you and everyone around you safe and healthy. Thank you so much for doing your test today.